Yeah, what a great week. It's been really a lot of, it's made me really happy to see under 1,000 cases every day for the last 3 days. Um, and you know, again, coming back to the numbers, the percent positive today was like 2.8%. And so this is all really, really, really good news. You know, I think Toronto's under 200 cases for the first time in ages. Peel was in the mid hundreds. Halton's sitting at 25 new cases today. Um, you know what people have been doing is clearly working. Um, so I guess today is June 2nd, and today is the day that the stay-at-home order expires. But in terms of the practical realities of people's everyday lives, nothing really changes. Um, so as it stands at this moment, the phase one of the provincial reopening doesn't happen until June 13th, which is when they'll start to open non-essential retail and increase the number of people that can gather outside and open restaurant patios and those kinds of things. And um, you know, there hasn't been a clear indication from the government that there's going to be any change to that timeline. So as it stands right now, kind of nothing changes for our day-to-day lives. But we certainly do have that sort of June 13th date to look forward to on the horizon. I guess the other thing that is significant today or the last couple of days, has been sort of clarity in terms of what people will be able to do for their second vaccine dose. And so people who did get the AstraZeneca vaccine as their first dose can certainly get a Pfizer or a Moderna vaccine now, according to NACI, which is the immunization sort of, uh, committee, and sort of provides guidance and information to the government about vaccines. So people that did get that first AstraZeneca dose at a pharmacy, there has there has been a lot of sort of challenge for people trying to coordinate a second appointment and trying to get that vaccine, and a lot of uncertainty about whether vaccine is going to be available for those people. And so anybody that got the AstraZeneca vaccine can go through the normal channels through the region to book their second dose when their age group becomes eligible for that second dose. So as of Monday, kids aged 12 to 17 can book their first and second vaccine doses. I went through that process for Lyndon and Isla, and I was able to book their first vaccine for June, and then they let me book the second dose right off the bat for some time in August. So that was great. So not only do I know that they're going to get their first dose, but I know they'll get their second dose at least 3 weeks before they go back to school. And so that was really, really fantastic. So it's nice to know that mechanism's in place to make sure as many school age children, age 12 to 17, can get those two doses before they head back to school in the fall. People over the age of 80, and also some people who are on medications that suppress their immune system, are also eligible now to book an accelerated second dose. So they can do that through the region. So as those numbers kind of go down, whether you got Pfizer or Moderna or AstraZeneca, you can get Pfizer or Moderna for your second dose. So you can book your second dose when your age category comes up, no matter what you got as your first one. So that's reassuring, and provides a little bit more clarity to people who did get the AstraZeneca for the first dose. Um, you know, Hospital admissions continue to go down. There's fewer than 800 people admitted to hospital with COVID now. The number of people on ventilators sits at about 360 right now. So from yesterday to today, there was a bit of an uptick in the number of people that are ventilated, that were ventilated, and that's just people who are sort of going through the stages of severe disease, and will continue to do so kind of over the next little while. Um, Anything else that's kind of interesting and new? I guess one of the things that I found really interesting maybe this week that may have gone under the radar, but perhaps has some interesting resonance, is the World Health Organization is moving away from categorizing the variants based on the geographic region that they came from, and they're moving instead to do a system of kind of Greek numerals. kind of like we have for influenza. So with flu, we don't talk about, you know, the Chinese flu or that sort of thing, or the South African flu or that sort of thing. It's H1N1, H2N5, H3N3, like those kinds of things, right? So I think the hope is to try to take the geopolitics out of the variant naming a little bit, and to try to sort of counter some of the narratives of kind of racism and blame that have come in the wake of the new variants emerging from different parts of the world. So I thought that was interesting. And also will probably make things easier moving forward in terms of just how we communicate and classify the emerging coronaviruses as new variants develop. Um, it's looking like it's going to be a really positive summer. Um, we are actually at, I think I was seeing 69% of eligible Halton residents have been given their first dose of the coronavirus vaccine, which is awesome for a couple of reasons. One is that that's a big number, which is really exciting. The province is vaccinating just shy of 1% of the population every day at this point. So it's likely that by the beginning of July, if the take up is there, we'll have about 90% of people having gotten their first dose. Um, but it also, to me, speaks to how committed people are to getting vaccinated, right? The fact that the take up rate is already this high and that they're still booking lots of appointments, that people um, are trusting the science, believing in the science, and willing to make this decision to get vaccinated for everyone's health and safety, right? Not just their own. And so that's really exciting, and that certainly gives me a lot of hope as well. Um, so that's, yeah, not much that's kind of new or different. I think just, again, the importance of kind of ear to the ground when it comes to the region in terms of announcing as those earlier appointments become available for people, because certainly if 90% of the population has gotten at least a first dose by July 1st, they're going to want to get more people in and younger people in for that accelerated second dose. And again, that's kind of, bearing out in most places across the country. The one exception to that rule, of course, is Manitoba. The numbers in Manitoba continue to be a struggle. But in a lot of ways, we're watching what unfolded here a few weeks ago unfolding in Manitoba, right? So it's not that they're going through a fundamentally different experience than we are. It's just that theirs is coming a little bit later. Um, but that too will pass. But it does speak to the critical importance of continuing to maintain social distancing, masking, all of those things until this thing is really and truly over. Yeah, that's my thoughts this week. Any questions?
My thing's frozen.
Oh no, I'm not frozen. I'm just.
Yeah, it's okay. It's my internet.
It's I don't see any point of trying to accelerate it. I'm sure other people could use our second dose as their first dose, but we're going to be double dosed in July sometime. After that, traveling. What do you think, Jack? I don't know. We might be able to travel to the Maritimes. I don't know if they would let anybody in who's not from there.
Yeah. I've been watching that as well because I would love to go to Nova Scotia. I would absolutely love to go to Nova Scotia and visit sort of, very close friends and colleagues there. There hasn't been any word yet about whether there would be some kind of exemption granted to people with vaccination. But as soon as I know, because I am highly motivated, I will let you know. Right?
Okay. Do you have to get a tattoo on your forehead saying
It says
double
V
dose or anything like that?
Yeah, it's a V.
Yeah.
Hopefully they put it in a slightly more, hopefully they'd put it in a slightly more subtle place. But
Yeah.
yeah, no, that is a political hot potato, the vaccine passport for sure. there are lots of places in the States where, at the state level, governments have made it illegal for companies and corporations, whatnot, to ask for people's vaccination status. In Canada, we're still waiting. It's hard to say. Certainly has been indication from some European countries that they would require some kind of vaccination passport in order to allow people sort of entry into the country. Certainly nothing so drastic as tattooing. But if it's important information. I mean, I think about sort of myself as a healthcare provider. It's important information for me to have in terms of knowing what someone's vaccination status is when it comes to assessing the risk of them coming into the office, sort of assessing the likelihood that the symptoms that they're experiencing are related to COVID or potentially to something else, and also being really mindful of ensuring that my most vulnerable patients are protected, right? So I would never not provide care for somebody because of their vaccination status. I simply could not do that, and I don't do that now. I have children in my practice and adults in my practice that have chosen not to get measles, mumps, and rubella vaccines, and that sort of thing for various different reasons. So I don't think people should have to fear that it will affect their sort of quality of medical care or their access to medical care if they're not vaccinated. But it may change the way that we when it comes to personal protective equipment and those kinds of things, for people that are vaccinated or not. It's hard to say. We'll kind of see how that unfolds over the next little while. But yeah, that's a big political question that governments I know are struggling with right now, and I'm sure businesses are struggling with as well.
Well, you're probably, as you hit the Nova Scotia border, you have to throw your Toronto Maple Leafs hat in the trunk. If there are any more Toronto Maple Leafs hats. Oh, okay, I know. Okay,
Did anybody see Las Vegas yesterday?
No.
Las Vegas is open to 100% capacity.
What?
No masks and no social distancing.
Oh, wow.
They opened yesterday. Yeah, the whole state of Nevada. So everybody's watching to see what happens there. Definitely. With numbers.
Yeah, absolutely.
But there was the crowds of people and they're all hanging around and taking pictures and man, 100% capacity.
Yeah, it's such a different places.
Yeah, and they're wanting the American Canadian border to open because apparently Canadians love Las Vegas and they spend millions and millions and millions of dollars down there. So they want the Canadians to come down to spend their money.
Yeah, I mean the Canadians can still travel, but they still have to quarantine when they come back for those weeks. Regardless, at this point, regardless of vaccination status, regardless of anything, that doesn't change anything right now.
No.
That's good. Works for me.
Anyway.
Well, thank you again, Dr.
Thank you, Anna.
No problem. It's definitely been a week with some light in it.
Yes.
Okay.
The kids that they just announced this afternoon, all the kids are going to be in school at home.
Yeah, they're not going to reopen the schools. That's right.
Yeah.
I could.
But he also said that they might put the step one a bit earlier than 2 weeks. They're talking about starting it next week.
So that we'll have to see what happens.
Look at the numbers, I guess, but it's all up to Dr. Williams, poor guy who's retiring.
Until he retires. Yeah.
Yeah, that's right. Yes. Well, thank you again, Anna.
Okay, thanks, Anna.
Bye, everyone.
Bye, guys.
Bye.
Thank you.